Well, good afternoon. We're moving in the right direction, and we need to keep going. And we can't stop now. We must stay strong. Our hospitals have capacity, our team is stockpiling PPE, and our testing strategy has allowed us to stay ahead of this virus. Because the sooner we can detect COVID-19, the sooner we can stop the spread and protect others from the infection. A few weeks ago, on April the 10th, I stood at this podium and promised you that we were going to ramp up our testing. We set a target of 16,000 tests per day by May the 6th. And thanks to our incredible team, thanks to the hard-working folks in our health system, we beat that target. And just over 20 days later, by May the 1st, we hit 17,000 tests a day. The good news is we're leading the country in daily testing volumes, both in total tests and per capita. Over 342,000 tests have been completed in Ontario to date. These gains are significant, but we still have a lot of work to do. We will not rest on our laurels. That's why we remain laser focused on ensuring we're testing our most vulnerable. We rapidly increase testing in our long-term care homes. We're testing those in group homes, homeless shelters, women's shelters, and other congregate settings. And as the key trends head in the right direction and the health system continue to be strengthened, it gives us confidence. It gives us the confidence that we can adapt. It gives us the confidence that we can reopen more places safely, knowing our health professionals have our backs. It gives us the confidence that we're getting close to opening parks, that we're getting close to opening retail for curbside pickup. It gives us the confidence that we're on the right track, that collectively, as a province, we're doing the right things and we're taking the right steps, that we're beating this terrible, terrible virus. And it tells us that we can't stop now. We need to continue looking out for each other. We need to keep taking the health advice seriously. We need to stay vigilant, and if we do, if we stay the course, we will defeat this virus. We can and we will. Thank you, and God bless the people of Ontario. I'll pass it over to Deputy Premier. Thank you.
Thank you, Premier, and good afternoon, everyone. When we first announced COVID-19 testing targets, 4,000 tests were being conducted per day. On Thursday, April 30th, we reached well over 16,000 tests in a day, nearly a week ahead of our target for 16,000 tests per day by May 6th. We did so by forming a province-wide COVID-19 testing network that includes over 20 organizations. This has allowed us to eliminate the backlog of 11,000 tests and then turn our focus to testing priority groups and vulnerable populations, including every resident and staff member in a long-term care home. Indeed, expanding testing is critical to containing and limiting the spread of this new virus, both in our communities and in long-term care homes and other shared living spaces. We are now a leader in Canada in daily testing per capita and rank among the top globally. Still, we continue to invest in further expanding our COVID-19 testing. Our strategy is focused on maximizing testing capacity by working as an integrated lab testing network across the province. This is being achieved through daily check-ins and processes designed to address the need for supplies, test turnaround times, alternative approaches to processing, and emerging technology. The integration of our laboratory network will serve as an enduring legacy once this outbreak is over, and a great example of how we can strengthen our healthcare system through integration to better serve and protect the people of Ontario. Thank you.
We'll go to the phone line for questions. Just a reminder, one question, one follow-up. First question.
First question comes from Martin Reg Cohen from the Toronto Star. Please go ahead. Hello, my question
Martin.
is for the Premier. You've
Yes.
talked a lot about the impact of the pandemic on our nursing homes and how you want to fix it. What's your personal view about the ownership of nursing homes? Given what's going on, is there a difference? Is there a difference between private ownership and public ownership in terms of the outcomes?
Well, I think there's a difference, but what I said right from day one, Martin, the system's broke, and we are going to fix it. But if you don't mind, Martin, I'm going to pass it over to the Minister of Long-Term Care.
Thank you. So, our ministry that was dedicated to long-term care started in the summer. And one of the first things we looked at was capacity issues in long-term care, staffing issues in long-term care. Many of these issues have been decades in the making, and this sector was neglected for decades. We look across the board, we see different homes being affected in many different ways, but obviously it's staffing that is a crisis right now. And this is not specific to any particular type of home, but we know that we need to move forward with a plan coming from this. Once we are done focusing on the crises we have at hand. Thank you for your question.
My follow-up is for the Premier. You've mentioned a lot of CEOs that you've talked to over the last few weeks of this pandemic. Have you also spoken to Mike Harris in his capacity as chair of Chartwell Homes? And if so, what did you learn from him? What did you say to him? And if you have not yet, will you reach out to him? And either way, whether you've spoken to him or not, what would be your message to him and to other operators, private or public, in this pandemic and going forward? What are they telling you, and what are you telling them, Mr. Harris in particular?
Well, I had, I think, one call in the last 6 weeks from former Premier Harris to ask how he was doing, and to be frank, I didn't even know he was the chair of Chartwell, but we're going to have that opportunity to sit down and fix these issues right across the board. But he basically, the conversation lasted a couple minutes. How's your family doing? How's yours? And that was about it.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, my first question is for either you, Premier Ford, or Health Minister Christine Elliott. We want to know if the province has considered, or is it already in the works, that certain hospitals in larger to medium-sized cities where there's multiple hospitals, could some of those hospitals be designated for COVID-19 patients, and therefore the hospitals that won't be treating COVID-19 patients could possibly be opened up to begin safely doing elective surgeries?
Well, you're pretty bang on there, but I'm going to pass this over to the Minister of Health. Thanks, Elliott.
Yes, thank you for the question. It is something that we are taking a look at as we develop our plan to open up elective procedures for cardiac cancer surgeries and other orthopedic surgeries. That is one of the suggestions, that we have a COVID-free hospital, so that there's one that will deal with the COVID patients, one that will deal more with the elective surgeries. But it's dependent on that and a number of other factors as well, how these hospitals will be able to open up, because among other things, they will need to have the staff. Some of the staffs, as you know, staff members have gone to assist in long-term care homes right now. They also need to have their own supply of personal protective equipment so that they can conduct these surgeries, in addition to the drugs and other medications they need in order to be able to conduct the surgeries. So that is one of the elements, having a COVID-free hospital as an idea, but there's a lot of other issues that have to come forward. But we are finalizing a plan. We hope to have it to present to all of you very shortly, because we do know there are so many people that are very anxious about having their surgery, particularly for serious issues like cancer and cardiac issues. So we are dealing with that, and as I said, we hope to have information, more detailed information for you very soon.
Thank you. And my follow-up question is for the Premier. We've been focused so much on what businesses can reopen and when, but people really want to know when they can safely hug a loved one, like their parents or siblings? You know, when can they invite maybe a small group of friends over to celebrate birthdays and anniversaries and other milestones? So are we any closer to getting an answer on that?
Well, I think we're getting closer right across the province. The numbers are coming down, Haley, and I think the opportunity will come hopefully sooner than later. Again, Haley, if I knew the exact date, honestly, I'd be telling you in 10 seconds up here. But none of us really know the exact date. Let's continue working hard all together as a province, and we have been, and those numbers are showing the results of that. And the sooner we can have some loved ones over, you're right, give them a hug, then we're going to get that moving as quickly as possible. So let's just keep working on reducing the numbers, and the quicker we do that, the quicker we'll be able to have some loved ones over for maybe a barbecue or so.
Next question.
Next question comes from Albert Delatala from Global News. Please go ahead.
Hi, my question is for the Premier. What happens to parents' money if a day school, such as one that we're investigating, the GTA declares bankruptcy under the emergency order?
Well, that's a very good question, and Albert, if you don't mind, I'll ask our minister that. But we did make sure that we had the parents stop paying. They wouldn't lose their spot. That was a big issue at one point. They were paying daycare, and the kids weren't going to daycare. So we were able to secure that, and also secure their spot in daycare. But it's a good question. Hopefully we won't have too many daycare facilities going under. But I will get back to you on that, Albert.
Thank you.
Thank you.
Next question.
Next question comes from Randy Rath from CHCH-TV. Please go ahead.
Hi, Premier.
Hi, Randy.
We've been hearing from greenhouse and nursery operators, and they're complaining that they aren't playing on a level playing field with garden centers that are
Sorry, Randy, you're very
attached
muffled.
to a
Can
grocery
you?
store or a similar store like that. That in those stores, in those group garden centers, they can go in and pick out their own plants, but it's only curbside and delivery at garden centers that are standalone.
Yeah.
Can that be opened up anymore with social distancing?
Yeah, you know something, Randy. Again, I think you're bang on. I thought it was unfair too. The reason some of the big box stores were able to open up, they had pharmacies and food in it, but they had other items in there. And do I agree it's unfair? Yeah, I agree. And the aisles were a little wider in the big stores. But in saying that, stay tuned, Randy. We're going to have some good news for these folks this week. So we're going to get moving on that.
Okay, my next question is, on the weekend, we did a story down in Haldeman, Norfolk, about people not being allowed to go to their cottages along the shore of Lake Erie. The medical officer of health in that area has said, no people from outside of the community can go to their cottages, and the people that go to those cottages just go. They just want to go, take their own food, not interact with anybody, and just and then leave. And the chief medical officer of health, when I asked him last week, said that he doesn't really see a problem in that. And I'm just wondering if those people can't go to their cottages, should they be able to get their taxes back that they paid on those cottages this year?
Well, you're nailing all the questions, Randy, today, because I agree with you. I had a conversation with one of the mayors in Muskoka. I've asked to get on a conference call with all the mayors in cottage country, and we did the right thing, and we're continuing to do the right thing, make sure that we social distance and self-isolate when we can. But as we see the numbers come down, and by May the 24th, hopefully the numbers are going to continue coming down. We're going to have a heart-to-heart conversation this week with the mayors. There's only so long you hold back taxpayers from going to their cottages. I'll give you an example in Muskoka. In Muskoka, the vast majority of taxes are paid through cottagers, and you know, and the economy up there. When I was speaking to the mayor, people rely, the retail stores in the cottage country rely on cottagers from beginning of May, probably April, all the way through to September. That's their livelihood. So if people are responsible, the numbers continue to go down, we'll have that conversation. So if you follow up by the end of the week, I think it's Wednesday or Thursday, we're having a conference, phone conference, and I'll get their input. And I understand what they're saying, but if people go up to their cottage, bring their own food, don't go to the stores, stay at their cottage by May the 24th, there's only so long I can hold the big gates back from these people. They're going to want to go to their vacation property. I understand. And I think we've made the right decision about the cottagers. But as we see the numbers go down, let's just see what happens. But I'm going to have that a wholesome conversation with all the mayors in the next couple of days, and we'll see where we go from there.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi there. My question is for Minister Fullerton. Minister, it's my understanding that there are still about a dozen high-priority long-term care homes that have not yet received extra help from hospitals, extra staff, as well as more than 100 homes in the so-called yellow zone that also need help. So why has it taken so long, and when are these high-priority homes going to get the help they need?
Well, we're tracking this very carefully and monitoring the homes. We're in regular contact with the homes to assess their staffing situation and the PPEs. And as I mentioned before, the staffing crisis was pre-existing before the pandemic hit. And so we clearly understand the dire situation that our most needy homes are in, and we're making sure resources are getting to those homes while we monitor the others. So whether this comes through hospitals or home care or the military assistance, which we're all very grateful for. But we're making sure we get PPE to our homes within 24 hours if they need it. We're making sure that we have staffing that's adequate and making sure the standards of care are held. Looking at everything possible on the table to support all of our homes as we get through this crisis.
But why are there still 10 homes that are in a high priority zone that have not received anything? And also, why aren't you revealing which names in the province need the most help? Why can't you tell the public and the family members if their home is among them?
Well, what we have is we've been very transparent. We have a list that's publicly available so that people can see the status of the homes. And we're making sure that the homes that are identified as urgent need are getting the help that they need. This is an ongoing effort. We're working across the board to make sure our homes get the support they need. And 24 hours a day, we have a command table that has priority aspects to it, so making sure that those regional tables get the support to our homes that need it. There's a complete structure that is coordinated to getting that help out to our homes. And we've been very transparent about the numbers. We've been very transparent about the homes. We've been transparent about the homes needing military assistance. And I believe that that is the approach that's necessary, transparency, and we'll do everything possible to make sure those homes get the support that they need.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi there. Good afternoon. My question is for the Premier. Premier, in other provinces, some businesses feel a bit hesitant to open because right now they don't have the proper PPE available. Last week you had mentioned that the province would try to help businesses that need help finding the proper protective equipment for their employees. Do you have any more clarity on exactly how the province will help businesses find PPE?
Well, I was just on the phone with a couple of large retailers this morning, working with the Retail Association and other associations within the retail sector. And, you know, they in some cases, they have better contacts than the government overseas on buying goods. Some of them are the largest buyers of goods to put into their stores. And I mentioned to them that we need to bring in as many PPE items as possible. They're telling me they're okay. They can get it in. So I'm relying on the Retail Association and other large retailers. If you have extra, share it with some of the smaller retailers as well. Plus, we're ramping up on the domestic side on the PPE, especially the N95s with Woodbridge, and we're going full out. On the weekend, I went over to a gown and a mask manufacturer here in Toronto to see how they're coming along. But it's all hands on deck. And as every day goes by, more and more calls are coming in saying that people want to invest and open up a PPE manufacturing facility. So and we also have that fund of $50 million to support people that want to open up. So we're doing everything we can to make sure we get domestic supply as soon as possible. There isn't a day, Colin, that goes by I don't talk to 4, 5, 6 people, I'm being conservative, that want to open up, and the big players that don't have a facility here. Spoke to one of the big companies this morning, and I said, you got to start manufacturing here in Ontario or Canada somewhere. You can't be shipping it in from the U.S. You know, these days are going to be over. We're going to start relying on ourselves rather than relying on these foreign countries, foreign governments that when you know, all heck breaks loose, they close the borders and say you aren't getting any more goods. We're all over this, and we've ramped up with a couple disinfectant wipe companies as well that are ramping up as well. So we're getting there, but we're moving as quickly as we can.
Next question.
Okay, and
oh, sorry.
Thank you for. Oh, thank you. And Premier, just on education, you know, today was supposed to be the day that students were heading back to class. Obviously, that's being pushed back until next month at the earliest, if possible. I'm just curious about distance learning for students. You have young children in your extended family.
Yeah.
What have you been hearing about how well distance learning is working right now? Because some teachers say it's quite difficult to actually educate students virtually.
Yeah, I think the older kids in high school and probably middle school, they understand it. The younger kids, it's the 5 and 6 year olds telling them they can't play with little Susie or Johnny. It doesn't really sink in. So that's something we really have to focus on, and especially if the decision is made, and the decision has not been made, if the kids are going to go back in June sometime. But very good point, Colin. We really have to monitor it. But I think the high school kids, they get it. Matter of fact, I know they get it. And I think the other kids, grade 6, 7, and 8, they get it as well.
Next question.
Next question comes from Cynthia Milliken from City TV. Please go ahead.
Hi, Premier.
Hi, Cynthia.
Today you dipped your toe into opening up the economy ever so slightly. But I'm curious why random community testing has not started when experts say that it needs to begin before the economy opens so that a proper baseline is created. Why hasn't the government started that?
Well, I had that conversation with some of the folks on the health table today, and it is being started. Our main crisis was obviously long-term care, retirement homes, congregate living locations, so we want to put all our resources there first. But moving forward, we're going to be doing that. Also, I know you didn't ask this question, but I'm going to mention it anyways. Had a conversation with the Deputy Prime Minister today. I'm going to follow up with the premiers. We have another premiers meeting. I believe it's on Thursday. We need a national plan for contact tracing. And it's you know, right now each individual province is doing it, but we need a national plan, work with the federal government and all the provinces, the 10 provinces and the 3 territories. It's absolutely critical moving forward for many reasons, especially not to mention research as well.
Thank you. And for follow-up, some provinces are creating family bubbles where they can merge together and, you know, go see a grandparent, for example. Would that be a next step in Ontario?
If the numbers continue going down, let's just see. I just don't want to answer right now this early. Maybe if you ask me this next week, we'll see some even better results than what we've already seen.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier.
Lisa.
I spoke with some PSWs in long-term care homes who contracted COVID-19 after taking care of infected residents with just a surgical mask. They say they want the option of an N95 mask, and there is some evidence out there that points to the possibility COVID-19 can be spread via airborne particles. So why not take all possible precautions and give healthcare workers the option of an N95 mask as the research is coming in?
Well, I agree, but let me pass this over to the Minister of Long-Term Care.
Thank you. So first of all, I want to acknowledge all of our frontline, the personal support workers who are so dedicated and compassionate every single day, and how much I appreciate it. Looking at the PSW and the PPEs, understanding the Chief Medical Officer of Health gives directives in terms of the required PPE. Surgical masks are what is required for COVID-19 according to the Chief Medical Officer of Health. Of course, evidence is always evolving, and the scientific literature is being vetted by our public health officials, Public Health Ontario and Dr. David Williams. And so this is something that will have to be ongoing in terms of understanding the spread of COVID-19.
Thank you. And my next question is for the Premier. We've spoken to some business owners who say they were caught off guard by Friday's announcement about opening up, and they would have appreciated more time to get the PPE and implement the appropriate safety protocols. We've also heard from garden centers that say it's too late for a lot of their flowers and plants that are going to waste. So my question, kind of double-barreled, when did the province inform these businesses of the plans to reopen, and couldn't places like garden centers have been open this entire time with physical distancing measures in place like grocery stores?
Well, with anything, we talk to the Ministry of Health, we talk to the Health Table, talk to the Minister of Labour, we talk to the stakeholders, the business sector that they're involved in, and we get their input. Now, there's never a decision that one person makes. I don't make a decision by myself. I always consult with people. We try to give them a few days, but all those businesses were all seasonal businesses, outdoor, gardening and landscaping, or other areas, even the marinas too. So there haven't been a huge issue that I've heard on the retail side, because we really haven't opened up the small retail stores yet. But when we make that announcement, I'll give it the message right now. Retail, start prepping, no matter if it's 3 weeks, 4 weeks, 2 weeks, whenever it is. Start prepping, getting masks ready. So there's the warning right now. It's coming. It's inevitable. The numbers keep going down. We're going to get the economy going based on health and science. I got to keep emphasizing that. Just because we open up these stores, it doesn't mean it's a free-for-all. We still have to follow the protocol of the Chief Medical Officer, and we're going to continue making sure that we take those measures.
Last question.
Last question comes from Rajinder Saini from Parvasi Media Group. Please go ahead.
Good afternoon, Premier. This is Rajinder Saini from Parvasi. Premier, ethnic media outlets in Ontario and all over the country are playing very vital role to inform their communities, hundreds and thousands of people whose first language is neither English nor French. But these businesses are struggling at the moment, Premier. They are not able to print their newspapers. They are not able to broadcast the radio shows because they don't have any ad revenue, which is the only source of their income. So having a small size operations, most of their staff is not on payroll, like paper distribution or sales. So they are not eligible for $40,000 loan from the federal government, and not for 75% wages benefit. So they are really struggling. Yeah. Any help they can expect from the government?
Well, very, very good point. And right as soon as we put out the advertising budget, my first comment out of my mouth was we're making sure that the ethnic media gets a piece of the pie to keep them going. I want to thank not just the ethnic media, but media in general. You've been absolutely incredible getting the message out. We've all worked together, and I just want to thank the media for doing that. But maybe what we can do is follow up on a call, because right from the get-go, everyone should get an equal piece of the pie, per se. And I emphasize to make sure the ethnic media ended up getting some funding for advertising about COVID. I will follow up on that.
Premier, my follow-up question is regarding emergency rental assistance announced by the Prime Minister. I have three questions. The first question is that TMI, which is very substantial part of the gross rent, is that included in this rent, in this assistance? And number two, most of the landlords are not willing to take that forgivable loan and put their 25% share. So that is why most of the businesses, they have got already notice.
What I understand, I'll confirm this with the finance minister, it's all inclusive. It wasn't before, now it is. So just to break it down, the landlord would pick up 25%, the tenant would take 25%, and the federal and provincial governments would pay the 50%. And it's over a $900 million plan, and hopefully they can work through this. But if we continue seeing the downward slope, hopefully we won't be in this position over the next few weeks, as long as we get approval from the Chief Medical Officer, our health team, and our Minister of Labor. I just want to keep emphasizing that, because I just don't want people thinking we're going to open up and we're all free to do what we want. It's just not going to be that way for a while. But hopefully we'll be able to get these stores opened up sooner than later.
Thank you.
Thank you, everyone. Thank you.